Before we get into the agenda and kind of the meat, I did just want to recognize that our interim commissioner, Major General Tommy Baker, is joining us. And sir, if you had any remarks at the outset before we get into the meat, welcome any comments you have.
Thanks, Travis, Ron. Appreciate the opportunity to stay in on this lunch and learn. I want to say thanks to all of our partners at both the regional, national, and state level. This is a partnership, and I realize that more each day that I'm here. I've been here about 90 days as an interim commissioner, and have learned a lot about what this department does, and there could be a more vital subject for us to be talking about. Suicide prevention. That's been a national level issue for a long time, but we have still not conquered that, and we've got to constantly revisit what we can do as departments, agencies, as and across state and this tragedy. So, eager to hear what everybody has to say. I want to say thanks to our Veterans Health Administration partners, our Tennessee Suicide Prevention Network partners, and our county CSOs out there who are a vital part of our team. So I'm just ready to sit back, listen. Thanks to everyone for your participation.
Great. Thank you, sir. We appreciate you joining and offering those remarks, and get into the agenda there in front of you. We're going to give just a real brief overview of service members, veterans, and families suicide prevention efforts in Tennessee. Then we'll get kind of into the meat of the presentations and really just introducing for one another the Tennessee Department of Veterans Services, the Tennessee Suicide Prevention Network, and the VA, the Veterans Health Administration, and then try and leave about 10 minutes for questions at the end. I'm excited today because I'm joined by two amazing Tennesseans that I've had the privilege to work with over the last several years on suicide prevention efforts. Misty Leitch, who is the Executive Director of the Tennessee Suicide Prevention Network, and Rob Campbell, who is the Chief Mental Health Officer for the VA Mid-South Healthcare Network. Just two amazing folks doing great work across the state, and just excited to have them as well as their teams joining us today. As Ron alluded to at the outset, really it's a networking opportunity to share some information, some resources that you could use in your local communities to combat the issue of veteran, service member, and family member suicides, and excited to share this information. There have been two ongoing efforts since about 2018 focused on this issue broadly across the state. In 2018, the Tennessee Suicide Prevention Network's Advisory Council approved the formation of a statewide task force with the goal of reducing veteran suicides through prevention, intervention, and postvention efforts. This task force was co-chaired by TSPN and our department, the Tennessee Department of Veterans Services, and we've worked to develop a toolkit consisting of recommendations and resources to help prevent veteran suicide that we hope will be published in the very near future. Importantly, I think the work of this task force really laid the groundwork for an effort that's ongoing right now, and that is participation in the Governor's Challenge. In early 2020, Governor Lee agreed to participate in the Governor's Challenge to prevent suicide among service members, veterans, and their families. It is a collaborative initiative between the VA's Veterans Health Administration and the Substance Abuse and Mental Health Services Administration. And the objective of this whole challenge is to form an interagency team of state leaders and policymakers to develop, and then more importantly, to implement a strategic action plan to prevent and reduce suicide among the SMVF population. Our interagency team in Tennessee is co-chaired by Misty Leitch and Laura Rasnacki from the Veterans Health Administration, their medical facility in Mountain Home. We've really spent the last several months in a variety of virtual policy academies, beginning to craft an action plan for Tennessee, and now are in a stage where the group is beginning to move towards implementation of some of those recommendations and best practices. So a very high-level overview of the statewide efforts that are ongoing across the state of Tennessee. I'll have the opportunity here just to briefly kind of introduce the Tennessee Department of Veteran Services, a bit about what we do in our organization, and then we'll get to hear from our partners in a similar way. And again, the goal is to connect the various teams and the representatives that are participating in this, and trying to find another tool that we can add to our toolkit and use in our day-to-day work. TDVS really two primary missions. The first is providing benefit advocacy and assistance to veterans and their family members. We do this through a network of TDVS field office and also working with a network of nearly 95 county partners and the Veterans County Service Officers. They are absolutely boots on the ground, talented and resourceful individuals that I think will be able to take some of the information we're sharing and the tools that our partners at TSPN and VA can provide and bring them to bear in their local communities. Our department, we are organized into 3 regions, and you can see them on the map in front of you. We partner with the counties in those regions and supervise the various field office personnel that are assisting in connecting veterans with benefits. We also operate and maintain state veteran cemeteries in the state. There's currently 5 with a 6th planned for the Upper Cumberland region, White County, in the not too distant future. Each region, an assistant commissioner has responsibility for each region. In the West, that's Patrick Rice. In Middle Tennessee, it's myself. And then in the East, Lorenza Wills. And each region also has a regional director that has primary responsibility for working with our field office team members and then really serving as that connective tissue for our county partners and the department. In West Tennessee, that is Spearden Roditas. In East Tennessee, Tim Forte and Steve Bell in Middle Tennessee. So that very briefly is just kind of a snapshot of the Tennessee Department of Veteran Services, who we are, what we do. The last few slides of this deck contain all the contact information for our department, so we'll be sure to share that information. And with that, I'd like to take an opportunity to turn this over to our next partner. So Misty, if you'd be kind enough to tell us a little bit about the Tennessee Suicide Prevention Network.
Hi, thank you so much for having me. I'm honored to be here, and I hope you can hear me okay. Thumbs up. Can you hear me okay? Perfect. Thank you, sir. So my name is Misty Leitch. I'm the Executive Director for TSPN. I've had the incredible honor of serving alongside Assistant Commissioner Travis Murphy, along with Rob Campbell. I have to make sure it's not Cotterman because there's a lot of Robs and they're all great people. So we have had, we've made some really great progress. So just a little bit about TSPN in general, as you can see in the map in front of you, we have 9 regions across the state, and that's how we segment the state. In each of those regions, we also have a regional director. So there's direct boots on the ground individuals who oversee the implementation of Tennessee for suicide prevention, as well as coordinate activities to promote suicide prevention within their region. They work with the volunteers within that region to help carry out not only the strategies, but provide free trainings on suicide prevention, and we even do suicide post-prevention and provide trainings in that area as well. So have a worldwide communications director as well as the deputy director. We are we're funded by federal grants as well as state grants, and we do have a governor-appointed advisory council. And so within each of those 9 regions, there are 3 to 4 appointed advisory council members. I may have to step outside if you guys are getting a lot of background noise. Just let me know. I'm happy to do that. So that is kind of TSPN in a nutshell. Our governor appointed advisory council, our 9 regions, and our non-regional directors. And our goal is to reduce the number of suicides that Tennessee experiences. The latest data that came out is the 2019 data, and unfortunately, we did see a rise in the number of suicides in 2019. We anticipate hopefully a decrease in the number of suicides in 2020, which is a little opposite of what the media. We do have preliminary data from January of 2020 up through about August of 2020, where our findings do show a significant decrease in the number of suicides lost. So we are pleased about that. Travis, is there a next slide for us, or is this it?
There's not. This is
Okay.
the slide we have for you.
Perfect. Okay, great.
Good.
Don't let me talk too much. If my time is up, just let me know.
No, you're good. We're watching time, so you're fine.
Okay, great. So, like I said, we started the Veterans Statewide Suicide Prevention Task Force, as Travis mentioned earlier, and we had really an outpouring of individuals, leadership from across the state that wanted to join those efforts and be part of, strategies and ideas on how to reduce the number of veteran suicides we were losing in Tennessee. And we have made great efforts, and we, as he alluded to, we are our toolkit, our book is at the publishers. COVID, among other things, has slowed down production of that document, of that booklet, but we are hopeful to have it within the next few weeks in hands and then be able to disperse across the state. Through that, through our efforts with this statewide Veteran Suicide Prevention Task Force, some of us were also part of the Mayor's Challenge to prevent suicides among service members, veterans, and their families. And Clarksville, Montgomery County is the only county in Tennessee that joined this Mayor's Challenge, which is another joint venture. It's very similar to the Governor's Challenge, just on a smaller scale. So we had done a lot of work in the Clarksville, Montgomery County area with Bill Harpel, who's the government liaison for Fort Campbell through the mayor's office. And we've done media campaigns and held events and a lot of really great efforts put there. And I believe that through what we did in the Mayor's Challenge, Governor Lee said, okay, let's do the Governor's Challenge. And so we merged the statewide the Veteran Statewide Task Force with the Governor's Challenge to prevent suicides among service members, veterans, and their families. And as Travis said, we've done a ton of virtual academies, implementation academies. We have more academies coming up, and we're really looking at 3 areas. One is how to screen and identify individuals at risk of suicide, specifically veterans, service members, and their families, right? And then we're looking at how do we screen them? What do we do after we identify someone that is at risk of suicide? We're also looking at lethal means counseling and being able to provide effective counseling to support systems of individuals who are at risk of suicide. And those groups continue to meet. There's 3 subcommittees, and I feel like we're making really great progress. Sorry, the group is going on break, so I'm going to take you guys with me, or you can move on to the next speaker, sir.
Good. Well, thank you so much, Misty. We appreciate you joining us today, and the members of your team that I saw are on as well, and just thankful for all you do across Tennessee. And so we'll move on to the next slide and the next presenter, and that's Mr. Rob Campbell, the Chief Mental Health Officer of the VA's Mid-South Healthcare Network.
Good afternoon, Travis. General Baker, thank you for the opportunity to speak with your staff today, sir. Really appreciate it. I too echo Misty's words, dating back a couple of years now when we first started the work with the state task force, and then being able to see that roll into the Governor's Challenge. Know that the Governor's Challenge is not happening in every state. The states that are participating in the Governor's Challenge across the country are the ones who have indicated a desire to be part of something that happens in their state and their communities so that they can affect the veteran suicide rates. We are very fortunate that the leadership of the state of Tennessee embraced this, and we see a lot of good things coming from the work that's already been done. I have to tell you, in looking at the map that was up previously, my background is the product of an Air Force family, 21 years with my dad, who's a retired E7. And from that life, I found myself in Tennessee many years ago, working community mental health down in Monroe County. For reasons that my wife still wonders about, I actually responded to a postcard from a recruiter and spent the next 22 years on active duty, moving my family around the world. For the past 10 years, we came back home. And it's for those reasons that this work, like for all of you, is so near and dear to my heart. This is all about our neighbors. I've truly been grateful to have the opportunity to work with Travis and with Misty in the work that has been underway for the past couple of years. I can tell you the emphasis in the VA now is to promote a community-based approach to preventing suicide. Many of you may hear the numbers ranging from 17 to 22. The one I hear most often is 20, 20 too many veteran suicides each day. But what you may or may not know is that 70% of those suicides involve veterans who get no health care from the VA. We don't know them. They're either getting their health care in the community or they're not getting any health care at all. And so this public health strategy to emphasize partnerships with our community agencies and leaders will give us a chance to really tailor some local efforts to respond in your communities, with you being the folks, and I say you because you're one of many, that can make an impact in the counties and the cities where you live. Travis spoke at length about the governor's challenge and how that has given us really an opportunity to create an overarching blueprint for the state of areas to focus on. And I think Misty hit on those three primary areas we're looking at to identify and to be able to accomplish suicide risk assessments, to promote connectedness and improve care transition for folks. You know, so many folks leave the military, and when they leave the military, they leave that camaraderie. They find themselves with isolation, and they find themselves lacking that mission and that sense of purpose that they had before. So this is critical to the work that we do in suicide prevention. And then finally, the lethal means safety and also safety planning, something that you may or may not be very familiar with. But we know by the work that we've done that if we have folks who come into our emergency departments that have mental health issues that are not going to be hospitalized, we need them to leave that emergency department with follow-up care being made available to them. We need them to have a safety plan that gives them something to refer back to if they find themselves in crisis and they are at a place where they're thinking about things that are irreversible. We want them to have something that they can pull out of their back pocket. Air Force pilots would have said they're going to pull the checklist out to see what to do in the matter of crisis. I kind of look at the safety plan in the same way. So in order to move forward at a community level, the VA nationally has funded something that they're calling the Community Engagement and Partnership Program. We are part of the region that covers Kentucky and Tennessee. We are one of 4 regions in the country who've been selected to be a part of that, 4 out of 18. And we were selected because of the work for the task force, the governor's challenge, And within our VA hospitals, we had already created what we were calling Eliminate Suicide Work Groups that had community partnership already a part of what we were trying to do. We've got funding to hire 11 staff members that we have spread across the state of Tennessee. These folks are licensed clinical social workers and program support assistants. I'll tell you, the slide that Travis has only has our community engagement and partnership coordinators on it. We now have an additional 4 program support assistants who are invaluable to the work that we're doing. Many of them are veterans. They know what needs to happen, and they've been a tremendous support to the LCSWs that were hired. These folks are spread across the state from Johnson City to Knoxville, Chattanooga, Murfreesboro, Nashville, Clarksville, and Memphis. They are stationed in those locations, but the goal is to become a part of community coalitions that already exist in those areas, and where none exist, moving out into the rural areas and helping to get them started. For me, I think that's where you as a group of county veteran service officers can be a real asset to this effort. You know the leaders, you know the formal and informal leaders in your communities. So my hope is when some of these people, and they are actually on this call today, come knocking on your door, it will be opened and they'll have a chance to give you that, I don't know if you can have an elevator speech at the front door, but a chance to tell you what they're there for and why they're there. You know, Misty alluded to this already, but the suicide rates in our communities, not just the veteran population, have continued to increase. I think back to my time in the Air Force, the most success we had in impacting the suicide rate was when people recognized that it was going to take more than the folks who worked in the hospital. It was going to take community leadership. It was going to take the soldier, airman, sailor, Marine, Coast Guardian to get involved and be concerned about that person. When we say we take care of our own in the military, that needs to translate into our communities. So many times, this is something people are afraid of. They're afraid of saying the wrong thing. They're afraid of doing the wrong thing. We have opportunities if we can bring people together to provide education, information, and referral on how to get them connected to services, and then to provide the support that's needed for these families, for these service members and veterans. So my hope is the information that we're sharing with you today can move forward to a community level where our community engagement partnership coordinators can meet with you and some of the folks in your communities and carry this work forward. I've been working for the VA for about 10 years now. I can honestly say this is the most exciting thing I've seen happen in that 10-year period. I think we really have an opportunity to make an impact. So very grateful for the work you guys do every day, and we look forward to working with you going forward.
Thank you, Rob. Really appreciate that. And, you know, I hope everybody can see just the passion and knowledge that these folks and their teams bring to this challenge across Tennessee, and gives us a lot of time here to kind of just talk about these resources and open up some question and answers. And I'll kick off a little bit. I'll be honest, you know, when I was asked as TDVS's representative for this work, I was a little intimidated at the outset. I am not a clinician. I have zero background in mental health, suicide prevention. And, you know, I kind of found myself thinking, how can we, you know, as a department and our county partners impact this issue, right? And I think what we learned in the course of our work and what Rob alluded to is the data tells us that 2/3 of veterans that die because of suicide are not using VA benefits. And so, that is what our field offices and county partners do each and every day. We connect service members, veterans, and their families with the benefits they've earned because of their service. And I think that's really an area where we can, make a tangible impact. Continue to connect veterans to not only VA benefits, but through educating ourselves, other community resources that are available to them. And then our department has undertaken a training effort, and each of our employees, and we've offered it to county partners as well, has participated over the last several months in a suicide prevention training. So, Rob, you mentioned the newest team members at VA. Misty, you mentioned your regional directors. If there's a county partner on this call, on this presentation, that wants to proactively reach out and take advantage of some of those resources, how would they go about doing that?
Well, I know that you have a roster of those names that I provided. I don't know if, well, there you go. Let me be quiet and let Misty talk about her folks. Whichever one you want to go to first.
Go ahead, Rob.
The names that you can see on that list right now are our folks that are in those different localities. The names you don't have on there that may pick up the phone and answer would include out in Memphis, Miguel Hayes, who works with Patrick Kennedy. Keith Talley is working with Leah Sears and Caroline Kova in Clarksville and Nashville. Ricky Kite is working with the folks in Murfreesboro and Chattanooga, Micah Taylor and Jolene Cook. And Lisa Potter is working with Autumn Carasillo and Stephanie DeMay in Knoxville and Johnson City. So I think that we've got a roster of your folks by name that we can have those that I just named reach out to them and say hello to them and see if there's an opportunity for them to connect.
Yeah, and I'll follow
It's
right
on the
behind
webinar.
that.
Our names are up on the screen.
Okay, so yep, thank you. That is Molly Colley with TSPN. She is one of our regional directors, and you can see that we do have a vacancy in Northwest Tennessee. Can you guys hear me? Because my phone is just circling.
Yes.
Okay, perfect. So we've got Lindsay in the Southwest, like right above Memphis. Justin Johnson, who I believe is also on the call, serves as our Memphis Shelby County Regional Director. He is a veteran as well and is able to bring, personal experience and knowledge with him to this work that we're doing. Mary Ann Christian in our South Central area, Grace in our Mid-Cumberland areas or in Nashville, Mike Anderson in the Upper Cumberland, Rachel in Southeast, Emily Hager, who is very brand new. She started with us on Monday. She is also a veteran, and she's actually featured in our toolkit that we're having published with her story of being a veteran and her story of losing her first husband to suicide, who is also a veteran. So again, she's able to bring that lived experience piece and provide that input into making the work even more meaningful. And then Miss Molly Colley up in Northeast Tennessee, and all of their email addresses are on there. You can also go to tspn.org and put a face with a name. I invite those staff, those TSPN teammates of mine that are on call, if they would like to put their email in the chat box, to do so, and encourage anyone to reach out that may be interested in a free training. It can be an hour, it can be 10 minutes. We're happy to drop off resources, mail in resources that may be of interest. I do want to share with you guys on the line, we do partner with the crisis text line. So if you text the letters TN, the abbreviation for the state of Tennessee, to the number 741-741, you are immediately connected to a trained crisis counselor who can help on the spot and be able to de-escalate a situation and really provide immediate intervention services. There's also the statewide crisis hotline number and the National Suicide Prevention Lifeline. And you all will also likely hear in the upcoming months about 988, which is the mental health equivalent of 911. So be on the lookout for more information about that.
Hey, Misty, quick question. First, are these full-time positions? And then secondly, are they clinician positions that last time? A little bit of background there.
Mr. Baker, you were cutting out slightly, so I'm going to try to guess the questions that you are asking. Are these positions full-time positions? Yes, they are full-time positions, but they are not all clinicians.
Okay, thank you.
Yes, sir.
And after this presentation is over, Ron will certainly share the slide deck, which contains this individual contact information with everybody. Certainly for our county partners or team members that have an interest in connecting with TSPN or VA, you can feel free to funnel those requests through your regional leadership, and I'd be happy to facilitate making any additional connections. Let's see, I think I did see a hand raised, Mr. John Bolding. Did you have a question that you wanted to ask?
No, I'm good.
All right. Misty, maybe we could talk just a little bit about the success of the Clarksville Mayor Challenge and some of the strategies that they used in their communities that might be replicable or applicable across the state. I think that group, it includes, I think, the county service officer, the director of that office, and the team. And I know they made an effort to get into some of the the local governmental organizations and do suicide prevention training. Any other best practices that we could learn from that experience?
Absolutely, and I'm so glad you asked. I would actually invite Mr. Andrew Kester and his team who are on the call. Andrew serves as he is the Clarksville Montgomery County VSO officer, and he also is now the chairman of the Mayor's Challenge in the Clarksville area. And if he is on the call, I'd like to punt to give him an opportunity.
Sure, I see him here. Andrew, would you like to share anything you've learned?
Andrew,
He's there.
Linda, are you with?
Looks like we're maybe having some audio challenges there with Andrew. Does anybody else have questions? They want to pop something in the chat. If you flag, you raise your hand over there on the right-hand side of the screen. Anything that you'd like for any of these individuals we have with us to address or answer?
Yeah, Travis, I just popped up the TSPN regional directors map, a little bit more detailed than what was in the slides. And these are also available on our website with the link that I just sent this morning.
Perfect. And Rob and Misty, I'm sure that your teams have some brochures, materials, the VA suicide prevention and crisis hotline information. We can be sure we compile and try and share as much relevant information as we can at the conclusion of today's webinar.
Yeah, absolutely. I don't know if you guys can see this or not, but we do have a brochure for saving veteran lives in Tennessee. So it's chock full of helpful resources and information specifically to veterans that family members can pick up. veterans themselves can pick up, or anyone interested can.
Awesome. I think I saw a hand. Pam Roberson, did you have your hand up? Did you have a question?
Yes, sir, I did. I put it on chat, but no one's responded. What do we do in the case of a veteran who has received a letter, a proposal for reduction on his PTSD, and he's unable to see his doctor because of COVID? And when they send him for an exam, they send him to one of the contractor doctors. They didn't even sit there and listen to him. All they did was, he said, was ask questions off of a piece of paper. But he didn't write down their responses to his questions.
Okay, gotcha.
Sure. So I guess it's probably it seems to me maybe a two-part question. First is, how do we address this proposal from VA to potentially reduce benefits? I'd say let's take that and talk about that specific case offline. I'll reach out to you after.
Okay.
Maybe more importantly is it sounds like this veteran wasn't able to connect with a VA provider, and if I can get that specific information, I'm sure Rob would be happy to engage as well and figure out if there's a way we can provide some health care for this individual.
Okay, thank you.
Of course. And, Mr. Moorhead, see your question there in the chat. Absolutely, we'll get some of the brochures and different materials that we're talking about. We'll consolidate and push that out, and also can make that available on our website. So we have all these resources that we've talked about today available for each of you to use.
And Misty and Rob, I went ahead and put my email address there if you'd forward that, and I'll make sure I get that on our website as well.
Great. Let me add one thing to what I spoke about earlier. A lot of times in the past, I think that we've made concerted efforts to do community outreach and education. And in some respects, it kind of stopped there. The difference with this effort that I spoke about earlier, the intent now is to implement the plan the work that's happening at the governor's challenge level. And actually, those folks I alluded to earlier who are spread across the state are part of the work groups that are happening in Tennessee with the governor's challenge. So they have visibility, and they've been able to participate recently in some of the work that's being done to put that plan together. So their task is not just to plan the work that's happening at a higher level. Their task is to work the plan, and that's where we see this moving forward. If it's going to be successful, it's going to be them getting into your communities, meeting people that want to engage, want to be a part of the solution, and putting some resources in place that can make a difference. Some of them will be on a smaller level than others. Some of them are actually going to be larger ones that will make a big difference. I know in Knox County, as an example, the folks there in Covenant Health, I think there are 9 hospitals part of that healthcare system. They now have included a question when people come in to the facility: have you served in the military? That opens up the door for a lot of things. And those are the kind of ways that we can impact some of that isolation and some of that disconnect to services that we talked about earlier. And it's probably not going to be just a matter of getting people to the VA to get care. Some people live in areas where that's going to be more difficult. We're doing a whole lot of telehealth, but everybody doesn't want to do telehealth. So part of our efforts are going to be to educate community providers about the military, so that they can be what we would consider to be more culturally competent in recognizing who's walking in the door and why their service and their time in the military impacts who they are today, no matter how long ago they got out or how long they served. So it really is going to be work the plan.
Sorry, I'm scrolling through and just see a few additional hands here. Commissioner Baker, did you have a question?
I just want to ask Rob how much they have reached out to maybe faith-based organizations in a state like Tennessee that's got so many remote areas. There may be some opportunities there for people that are just, have a life's calling to work with veterans.
Yes, sir. You're spot on. As a matter of fact, we had a meeting yesterday afternoon with these coordinators that are online with us right now. We have encouraged them to reach out to the faith-based community. And we know that there's some upcoming training that's going to have, actually the VA chaplaincy is sponsoring it. And it's going to bring together clergy in the local community, and our mental health folks will be there also. But we have actually, I don't want to guess, and I think they may be online, but I think, Autumn, are you still online?
Yeah, I'm here.
Were you the ones who had met with some of the different churches in the area that we talked about yesterday?
So I want to say that was Ann, actually, and Haley that had met. It might have been Ann that had met with the churches. We are the ones doing the clergy event on the 20th
Okay.
with chaplaincy service.
So TSPN is also working with clergy. We work with a lot of Dr. Monty Burks leads with the Department of Mental Health and Substance Abuse Services, leads a faith-based initiative. And so lots of certified peer recovery specialists folded into that mix. And so our teammates at TSPN work with those faith-based initiative contacts within the community to, again, help promote suicide prevention across all populations, including veterans.
Awesome. Lisa Kiss is the county service officer in Davidson County, and I see she has her hand raised. Lisa, did you have a question?
Can you hear me now?
Yep, we can, Lisa.
Okay, perfect. Sorry about that. I was just curious if there was a statistically relevant correlation between homelessness and the suicide attempts.
So that's a really great question. I would love to give you an answer to that, but I can't because we do not track nor do we have accurate attempt data for any population. And the reason for that is, I mean, we do work with the Department of Health and we get reports right now. They're called Essence Alerts. And so we receive weekly emails from the Department of Health. And in these reports, we're informed of which counties have a higher than average rate of youth younger than 18 presenting in the emergency department for some type of suicidality. So that's how we're able to capture attempt data, but it's not 100% accurate because there are uncountable number of attempts that may not require medical attention, and so those attempts are never captured. And what I mean by that, to give you an example, is you may have a young lady who thinks that by swallowing 10 Tylenol, she's not going to wake up the next day, and she may go to sleep, and that's an attempt, but it's not one that would require immediate medical attention at that time. So as it relates to homelessness, one of the grants that we recently secured with the Department of Health is to develop these Essence response plans for adults all the way up through end of life. And so we'll be developing those types of response plans. And one of the metrics we can ask for is do they capture data related to homelessness? And so if you're interested in that, send me an email or send, yes, homelessness is definitely an increased risk factor for suicide. And so if that's something you would like for us to look into more specifically around the rates of attempts for individuals that present homeless, we can absolutely make that request of the Department of Health and think about that as we plan and develop our Essence response plans for adults and youth.
Hey, Lisa, this is Rob. We actually do have a database that will track some of those variables that you're talking about, such as homelessness. If we become aware of a suicide attempt or a completed suicide by a veteran, we have a national database that actually will allow us to compile that information. I don't think we don't have a rate, based upon that factor alone, but I'm pretty sure that we're able to say how many of the attempts that we're aware of involved variables such as homelessness. There's also, for any of the completed suicides, we do something called a behavioral health autopsy, and those variables are included in that data and rolled up. So we have that information for our region as well as nationally.
That's Rob, and you something that national database. I don't know if it's the same one that I'm going to speak on, but Tennessee was recently rolled into the National Violent Death Reporting System, and so we were one of the very last states to implement this data reporting system. Now it captures a lot more variables and data points, and so because we were so new to the game, we don't have data yet from it, but I am told that all counties are reporting into the National Violent Death Reporting System now. So we're hopeful that we'll start to receive data where I would almost guarantee homelessness is going to be one of those data points that we look at, as well as their veteran status. So I hope that's helpful.
Just scrolling through participants and chats, and I'm not seeing any additional questions. Either Rob or Misty, any closing thoughts, maybe items that you feel important to discuss before we move towards wrapping this up?
No, not at all. I don't stand in the way of ending meetings early for sure, but thank you very much for having me on, as well as my teammates that were able to join me. And it's always great to see you guys again. Rob, same to you, sir. And we're really excited about all the new partnerships, TSPN, the Department of Veteran Services, and the VA here locally. So thank you.
I would echo Misty's words. I think my understanding of the responsibilities of the county veteran service officers are many. Jack of all trades, I think would be how I would best describe my understanding. Just know that our desire is to put another tool in your toolbox, not to make you the mechanic. We want you to be a part of the process. And help us move this forward. We think that you're very influential people in the community, and you can help open doors and point us in the right direction when we're newcomers there. So we really appreciate your time today and look forward to the opportunity to work with you.
Thank you all. Thanks to Rob and Misty for being here for this journey over the last couple years that will continue. But I think everybody can see the passion, the expertise, and the resources that these partners can bring to bear in this challenge. So I hope you found this networking opportunity useful. Use these resources that are available and just continue to make a difference in your local communities each and every day. Ron, with that, I'll turn it back over to you. Thanks so much for the the opportunity to plug into this lunch and learn. If there's any housekeeping items we need to take care of, but we'll be sure to follow up if there were some questions we missed and share all the resources and information that we talked about today.
Yeah, absolutely. Misty, Rob, Travis, thank you very much for participating. We had 106 participants, county and state service officers that have engaged today. Again, on our website, if I can get those flyers, I'd like to get those posted up there as well. And we'll just keep the communications. And here's another slide here for the partnership for the VHA. So for optional training that we have coming up this month, I have posted in the chat the link. It should already been provided to you in the benefits bulletin for the NVLSP webinar, Effective Strategies for Written and Oral Advocacy Before the VA. Please register before Friday, March 19th. And our next monthly Lunch and Learn will be scheduled for April 14th at 11:30 a.m. If there's any further questions, by all means, you know how to reach us. And again, the contact information for both organizations are on our website. Commissioner, any last parting words?
Hey, no, just thanks again to Rob and Misty and all the county CSOs out there. I think Rob had a great comment. The county CSOs are a jack of all trades, and I don't envy the level of responsibility that you all have. But there's no way any of us can be successful without your input and your help. And so I just see this as one big thing. Thanks for everybody, and appreciate everybody participating today.
Well, thank you, Commissioner. And again, as promised, an hour or less. Have a wonderful week, and see you next month. Thank you.